Surrounding the vagina are pelvic floor muscles that play a crucial role in various bodily functions. The Pubococcygeus muscle, PC muscle, wraps around the vaginal opening, providing support and control. It is a part of the levator ani muscle group, which essentially forms the pelvic floor muscles. The Bulbospongiosus muscle encircles the vaginal entrance and plays a direct role in tightening or relaxing it. These muscles help control urination, support pelvic organs, and assist in childbirth. However, sometimes these muscles involuntarily tense or contract, leading to a condition called vaginismus. Vaginismus is the recurrent or persistent involuntary spasm of the muscles surrounding the vagina when penetration is attempted. The spasm makes the vaginal opening much narrower, often creating a sensation of it being blocked or closed. Attempts to insert something may feel like hitting a wall. Individuals with vaginismus may experience sudden tightness, pressure, or even burning at the entrance of the vagina. Excessive dread of pain during penetration is a common symptom reported by people with vaginismus. Thus, vaginismus is considered a phobia. The spasm is partly driven by brain signals. If a person feels nervous, scared, or anxious about pain, the brain sends a message to the pelvic floor muscles to contract in an attempt to protect them from perceived harm. Inserting a tampon, gynecological exam, or even thought of penetration or any physical touch near the vaginal area can set off the reflex and trigger a response in the pelvic floor muscles, particularly if there is a concern about it being painful or uncomfortable. The spasm acts as a defense mechanism, similar to flinching when something gets too close to your eye. It is an automatic reaction, not a lack of desire. Symptoms of vaginismus may appear during the late teen years or early adulthood, often when a person first attempts sexual intercourse, tampon use, or a pelvic exam. When vaginismus has been present from the very beginning, it is known as lifelong vaginismus. However, vaginismus can also develop later in life, even after years of pain-free experiences. It's also called acquired vaginismus. The reasons for vaginismus are not always clear. Some things thought to cause it include anxiety or fears about having sex, a painful sexual experience, sexual assault or abuse, an unpleasant medical examination or difficult experience giving birth, believing sex is shameful or wrong, or a painful medical condition like thrush. Not everyone with vaginismus experiences the same level of muscle tension. Some may have mild tightening, while others experience severe spasms that make penetration nearly impossible. Vaginismus is relatively common, but exact statistics are difficult to determine because many individuals may be too embarrassed to discuss the problem with their healthcare providers. Vaginismus is treatable, often through a combination of physical and psychological approaches. Pelvic floor physical therapy can help relax the pelvic floor muscles through guided exercises and techniques. Patient education and cognitive behavioral therapy, CBT, is a talking therapy that can help you manage your problems by changing how you think and behave. It's most commonly used to treat anxiety and depression. Couples therapy can address relationship issues that may be contributing to the problem. Gradual use of vaginal dilators of increasing sizes to reduce muscle tightness and build confidence. Vaginal dilators are smooth, cylindrical devices made of plastic, silicone, or medical-grade material. They come in different sizes, starting from very small, about the size of a pinky finger, and gradually increasing to sizes similar to a penis, tampon, or medical instrument. It trains the pelvic muscles to stop tightening involuntarily, and it reduces fear and anxiety associated with penetration. If you are experiencing muscle spasms or pain that makes intercourse uncomfortable or impossible, please don't hesitate to talk to your healthcare provider. You don't have to suffer in silence. Most of these conditions are treatable. Many individuals see significant improvements in both their sex lives and their mental health after receiving treatment.